Would now call on Dr. RDR, who's a chairman and director quality control at Arvind Eye Care Systems, Arvind Eye Hospital, Madurai. And he is going to talk on something very difficult. I don't know how he's going to address that. How do I ensure that my value system reaches my employees till the bottom of the ladder? So on to you, Doctor.
Thanks, Dr. Chitra, for this opportunity to talk. The last session, I think we had a lot of discussion on this particular area, so which makes my talk also a little bit easier. So it's about how do you build the right culture, values till the bottom of the ladder. It's really a challenge, and that's what many people also are during the last session. It's not moving. It's also not moving.
तुम जब आओगे ना तो 5 मिनट के लिए वो थिंक करना रैपिडली हेलो हेलो करके आ जाएंगे.
Okay. So, this is what we are talking. So, when a patient or a customer comes into any organization, in our case it's a hospital, they'll be able to observe the culture through various ways. A simple observation as how things are happening, by hearing, when they talk to a staff, how they respond, by talking to the staff, and it's also they will be able to feel and experience every moment. Every patient who comes in an organization at least touch at least 15 to 20 people in the organization. So the experience they have, the interaction they have, is what defines the organizational culture. So to put it, the organizational culture is how the team members interact with the patients or the customers, and also the patients observe how they interact with each other. That's also equally important. So, if they have a good experience, you are going to get a complimentary letter. Here a patient says that they had a good experience to the level they wanted to pledge, the whole family want to pledge their eyes for eye donation. So you can get a letter like this, or it could be a complaint. Here is a patient who came 3 times to get a complete consultation. He says that this is something that could have been done in 2 visits. This, because of your inefficiency, insensitivity of your staff, I had to come 3 times. So they are able to really observe, and many of them are also vocal about it. So coming to the values is what is practiced by our staff in day-to-day activities and in our interaction with the patients, and also between themselves. So that's a value part. And this is what gives a work culture. Work culture is what gives the identity to any hospital, and also this work culture is what gives the experience to the patient. And some of the core values, there are several values that define an organization, the patient interaction. There are just 3 of the important ones is compassion and empathy, equity and transparency. These are really important for a service organization. I've just cut down just because of the time. So let us know, I'm going to just talk about 6 or 7 principles. One is how we are going to implement these core values in any organization. So one is how this value, we talked about these 3 values, how these values are going to manifest, or the cultural components. And this is really important. You have to really understand how these values are going to manifest, and this is important for communication and teaching and training of our staff. Because it's also important for you to design the systems. It's not just about training or passing on that value to the staff, but how we are going to design the systems based on these values, which should be able to express these values. I'll just give 2 examples. For example, we talked about empathy and compassion. So patients appreciate the way they are really cared and respected in any organization. It's a cultural component. What we need to teach our staff is that they need to view the patient as a person, not as a piece of pathology. Don't call a patient like a cataract patient, a glaucoma patient. They are each one as a person. How do we treat with them dignity? How do we respect the need of each of the individuals? How do we also bring in caring, verbal and non-verbal communication into our interaction? So this is the cultural component people have to understand. So how do we convert this into a system? It's about how do we train our staff in communication? How do we structure our counseling, being responsive to patient? How do we have a protocol for vulnerable patient? How do we have a protocol for handling emergencies? Somebody with a special request. So if you don't have these things as a process or a protocol, it's not going to happen. It may happen with some people, not as a whole system. And how do we also be financially supportive for patients who need it? So this is briefly how do you systematize empathy and compassion. The next important one is equity. Now patients really appreciate knowing that they'll get the same good care regardless of their status. If our free patients know and feel that they're not going to get a good care in free hospital, we're not going to get them in the free hospital. All of them will probably try to come to the paying hospital, borrow the money. So you have to make sure that the clinical protocols are not influenced by the patient status. Whether it's a paying patient or a free patient, it has to be driven by protocol. And you also should not segregate patients by staff category. You have to really have good, competent people, both for your paying and free patients. So this is the cultural part. How do we are going to create a system? Is the patient's condition determines who's going to operate on the patient, who's going to handle the patient, who's going to consult the patient. A simple case, a junior person can do it, but a complex case has to be done by a senior person and operated by the person. And how do you also going to respond to request, and also having a range of choice so that people will be able to afford the care you provide in the organization. The second important thing is the leadership role in building that culture. So we all have seen you are able to have systems to align the activities towards the goal. The systems also help in effectively and efficiently using the resources. So systems are important for all these things, to actualize the value, to bring in efficiency, to bring in effectiveness. But only if these systems are practiced with the understanding of the value, then you can further refine that system. You can even create the system. Otherwise, you can have a system which may not change. But otherwise, if there is no change, you're not going to make great progress. So bringing that alignment is the role of the leader. He has to understand the value part. He also has to make the other staff understand the value part. That's the importance of the leader. The third important thing is how do you have the staff with the correct attitude? Okay, the knowledge and skills can be acquired. A lot of importance is given to that, or can be transferred in many ways which is not very difficult. But to have somebody with attitude, it should be inborn. So you should, a lot of discussion how you are going to select the staff. We had, people said, the challenges in selecting the staff with the right value. It should be either inborn or you have to inculcate it right from the beginning of their career in your organization. So we all know that if you want to have a good plant, you need to have a good seed. So when you select a staff, you have to look at the value fit than the skill fit. Look at the value of a person. Have a way. So when we have a fellowship training, we don't have any say on the postgraduate selection. It's all done by the government. But when a fellow comes, they spend 3 or 4 days in the organization. It gives time for the person to understand and evaluate us, and it also gives us a time to evaluate that person. So always do the value fit over the skill fit, and there's a lot you can talk about that, how it is done. The fourth important thing is how you align the staff. You have to really make the staff understand the value of the organization. We really spend a month, have our fellows, before they start the clinical work, they spend about a month in the organization to understand the value, the mission, and the vision of the organization. And again, every staff should be able to align themselves with the organization's vision. Whether it's a medical record department or housekeeping department, the mission statement has to be kind of modified, so that they really understand their role. And again, cultivating attitude through training is very important. For example, installation of an eye drop is a simple thing. But what instruction have to be given before you install the drop? What instruction you will give after applying the drop? Even giving a cotton wiper is very important. How you say it, your body language, your verbal communication, your non-verbal communication, how do you modulate your voice? And all of that, it's ideally done using some kind of a role play. And again, on the job training, sometimes we try to bring in people from outside to do the communication. Your own staff are really important because they really have the understanding of what your value system, because skills and knowledge alone is not enough, but passing on the values of the organization is also very important. Choose people who are really good and work as teachers, not somebody who's really good in the knowledge part of it. And again, staff empowerment is very important. Choosing somebody as a teacher is again an empowerment. In our department, there are occasions where we may have to reimburse the money. So there are many instances, many organizations, it has to be done by the management. But here we empower our MRD staff to do that. Select few people who can do that part of that. I also empower them in doing the day-to-day planning and management. They take on a lot of responsibilities and pride and ownership in that. And again, the important thing is how do you sustain these values? You create it. It cannot be done without feedback and reinforcement. And so for example, we do a kind of a feedback. Every day about 5 to 10% of the staff, the patients coming into our vision center, community center in the hospital, we take a feedback. There's a group which does it, and we also pass it on to the staff. The different centers really understand where they really stand compared to others. And again, sharing the feedback, whether it's a complimentary or a complaint, it has to be shared with the people. And just I would like to share, with this last interesting story. So one of our senior member observed one of our staff taking the slippers from a patient, because the patient is being brought from a free hospital to the paying hospital. This man was wondering why she has to take the slipper of a patient. When the person asked, the staff said, I gave the slippers to the patient because it was very hot outside. The patient was finding it difficult to walk. So this is not part of your training. But if the person really understands what the value of compassion and empathy, then they will do it. So that's the power of training. I think really we need to give a lot of importance for this part of it. So building the culture is about making ordinary people doing extraordinary things. As Dr. V rightly said, intelligence and capability are not enough. And there must be a joy of doing something beautiful, which will happen only if the value system reaches the last employee of the organization. Thank you.
Thank you very much, Dr. RD. I have been exposed to your system through my children who have grown there, and I do see you have a wonderful work culture, somehow which seeps right into the depth of the organization. But I'm going to ask Dr. Avinash and Dr. Girish, how in this state of commercialization and changing economics and changing trends of thought process you must have been a couple of decades in your organization? Less?
Yeah.
Less. So, less, whatever. How would you say that the work culture which Dr. Gulapalli Rao, was it sustained or it changed, and why it had to change?
Right, I think the answer would be very bold if I have to say that. Whether it will change, I think some sort of a change is anticipated, but if I understood the question right, if we have to sustain, what is the fundamental values of the organization, like what Dr. RDR is there, it is a very conscious effort, the next generation, to sustain it and see that it is being inculcated into the next generation with an uncompromising effort. So that's the first point, uncompromising in the foundational values. Second, it is just not about increasing awareness. It's the first step. A second is, the extension to it is, after the awareness has happened, it is important that how they would apply in day-to-day practice. If only awareness is there, it's just like watching an action movie. It's fantastic. 90 minutes runs through your mind, and after you walk out of the hall, it's like you don't take anything back into your life. There's no call to action. So if the leader has the capability to not only increase the awareness, but try to inculcate into day-to-day living of the or DNA of the work, and that would be a successful leader. So 2 points. Number one, if recognizing the foundational values on which the strata has been built, and second, not only increasing the awareness and seeing that how it is percolated and applied, like what Dr. RD had mentioned, and that's where the genius of the next leadership is all about.
Yeah, your thoughts, very brief.
I completely agree with what
Dr. Avinash.
They said that ultimately you need to understand your organization, and if whatever the founders have done is working for the organization, has brought it to this platform, the onus is on the next generation to ensure the perpetuality of that.
Yes. Thank you. So thank you very much,
Yeah,
Dr.
thank
RD, and do stay
Sure.
as our expert panel. And